the start, there was so much uncertainty, and there was uncertainty whether or not this would even impact us in the United States, because this was an infectious disease that was abroad, which there are many of. We had our first case early on in the pandemic before testing was even available, and it was in a patient that had traveled to Singapore and had an exposure. And so I remember those days of sitting there with her care team trying to figure out what the isolation protocol should be and what the treatment options were, because as you recall, there were no treatment options. And just making sure that all of the healthcare professionals that had to go in and out of that room constantly, the pulmonary doc, the hospital doc, the infectious disease doc, the nursing team, the phlebotomist, we were trying to limit those that were getting exposed and really make sure that we developed safety protocols to protect our team. Well, she was one of the first cases in the state of New Jersey, and we worked with the local health department. We had to send specimens off to CDC to be able to verify that this was indeed our first case. And this patient was with us for a long time, and it was early on where we were developing, respiratory protocols and prone ventilation, where you flip the patients upside down. We had to rent special beds, and this patient, as long also with our medical directors, we were able to establish what treatment protocols would then become standard as we became inundated with COVID patients in the months to follow. It was overwhelming for our team, and they stepped up to the challenge. We couldn't have been more proud of one another and the camaraderie that our frontline staff showed. Leadership rounded, making sure that everyone was taken care of, but just the sheer volume of patients, and it was kind of a surreal time because the world was shut down, right? All of our families were home, everybody was home. You would be driving on the parkway and there was no car. It was commuting time, right? It was normal time going into work, no cars around. You could go 90 miles an hour, it didn't matter because there was no one around. Going to the grocery store, you'd go in scrubs and people would just scramble away from you. It was just really a surreal time, and where healthcare professionals were going about their daily jobs and working like they've never worked before. And it was such kind of a disconnect between what a lot of the other world was living at the time. One of AtlantiCare's main pillars in our strategy to really provide for the community is partnering with the community and making sure that we have access. We are a community hospital. We serve those in our region first and foremost. So we made sure to roll out the testing to those in need, to work with the local health departments, and setting up the mega site for widespread vaccinations and making sure that those in our community, right, people were traveling from all over to the mega site to get vaccinations, but we made sure that those in our community, especially in underserved areas, had appointments so that they could be vaccinated. We were very clear on the demographics of which patients were being hardest hit by COVID, and we went out and made sure that those were being tested, having the information and education that they needed. We have employee resource groups that would reach out to individuals, community leaders, church leaders, and make sure that the education and appointments were available for those in our community that needed to be vaccinated. Between nursing and pharmacy and the National Guard, I think that it was almost like wartime. People just gave up their entire lives to serve others. And they would go to the mega site every day, and until the last vial was emptied of that day, they would constantly be giving vaccines. And it was such a service to not only the state, I mean, people drove from out of state because vaccines were so hard to get at the time, and it was our only hope of preventing severe disease and death, especially amongst senior citizens and those with other predisposition, health conditions. So the mega site truly was a phenomenal feat because of all of the logistics and the moving parts and getting vaccine in and getting that sheer volume of individuals in, and for the medical center to be running that with the military was really a novel approach, and it was widely successful. I think our record day was 4,000 vaccines in one day were able to be given. There is not one person working in healthcare whose career job hasn't been profoundly changed forever. At AtlantiCare, we're recognizing that. We recognize that we need to train the next generation of healthcare professionals. These are individuals that were educated during COVID. There's certainly been a lot of people leaving healthcare, and that's why our academic partnerships are so important, partnering with Drexel Drexel Med and Stockton and the nursing programs in the area to make sure that we are really setting up the next generation of healthcare professionals for success. The pandemic really also highlighted the fact that it's not just treating people's acute medical needs that we need to be following up on, but it's really the social needs, right? So making sure that the individuals in our community have access to food, housing, healthcare, preventative services, testing has been extremely important. So that's been a shift, is more of a public health focus in medicine. And also leveraging technology, right? We learned that we had to stand up telehealth immediately during the pandemic and realized that that was really a way to reach people that sometimes wouldn't be able to make it to appointments or see a doctor as quickly as we're able to. So leveraging technology, we have more AI now. We're really trying to change the focus around those pillars moving forward.